Chapter 7, Statistics, Making Sense of Uncertainty Source. Introduction to Public Health by Mary-Jane Schneider. 5th edition. Public health is driven by data, but data alone doesn't answer questions. To interpret data, we need statistics. Statistics help us make sense of uncertainty. In this video, we'll explore how public health uses statistics to quantify risk, evaluate screening, assess studies, and support decision-making. You'll learn why no study is 100% certain, what p-values and confidence intervals really mean, and how we balance cost, benefit, and perception in population health. Why statistics matter in public health epidemiology and all of public health relies on statistics. Why? Because public health deals with populations, not individuals. Health is influenced by countless factors: genes, behavior, environment, and infectious agents. Statistics helps us identify patterns and detect meaningful signals from complex data. The term statistics refers to both the numbers that describe populations and the methods used to analyze those numbers. Whether we are measuring disease rates or testing new treatments, statistics help us draw conclusions while acknowledging the limits of certainty. Understanding the uncertainty of science is rarely absolute. Even the best studies offer probabilities, not guarantees. For example, we know that HIV causes AIDS. But if a woman has unprotected sex with an HIV-positive partner, her chance of infection is about 1 in 1,000. That's not zero, but it's not certainty either. Another example, a woman with early breast cancer may choose a lumpectomy plus radiation. Statistically, 90 out of 100 women will remain cancer-free after 15 years. But May 10th still experience a recurrence. Statistics tell us what usually happens, but rare outcomes can and do occur. That's why science must constantly evaluate and re-evaluate its conclusions. Contradictory studies and probabilistic thinking. Sometimes different studies give different results. In 1995, the Nurses' Health Study found increased breast cancer risk in women taking postmenopausal hormones. A month later, another study found no increased risk. Which was correct? This kind of conflict is common in public health. Different methods, sample sizes, and biases can lead to different outcomes. That's why it's important to replicate findings, use larger, well-controlled samples, interpret data within its limitations. Statistics don't provide certainty. It helps us estimate how confident we can be. Probability p-values and confidence intervals. Probability is how we express uncertainty in numbers. One common tool is the p-value. A p-value of 0.05 means there's a 5% chance that the result occurred by random variation alone. That's the threshold for statistical significance in most studies. Another key concept is the confidence interval. It gives a range where the true result is likely to fall. A narrower interval means higher precision. But here's the catch. Even statistically significant results can be wrong, especially if the sample size is small or if bias or confounding exists. Power and the law of small probabilities. A study's power is its ability to detect a real effect if one exists. More participants equals more power equals more reliable results. Small studies often fail to detect true effects or exaggerate chance findings. The law of small probabilities reminds us, improbable things happen more often than we think. That's why we sometimes see cancer clusters in neighborhoods, even if no real cause is found. Larger studies help separate signal from noise. Screening tests and their limit. Screening is central to public health. It helps catch diseases early when they are more treatable. But no screening test is perfect. Tests are either sensitive, specific. For example, mammograms are sensitive, but not always specific. That means they often detect non-cancerous growths, leading to anxiety, biopsies, and cost. Screening is also prone to lead time bias. Survival appears longer simply because the disease was found earlier. Overdiagnosis bias. Some cancers never progress, but still get treated. Bottom line, screening saves lives, but how and when we screen matters. Rates, adjusted rates, and life expectancy statistics also help compare population health using rates. Birth rates, death rates, and fertility rates. Crude rates show overall numbers. Adjusted rates account for age or gender differences. For instance, Florida has a higher crude death rate than Alaska, but that's because it has more older residents. After adjusting for age, Alaska actually has a higher mortality rate. Other metrics include life expectancy, the average years a person is expected to live, years of potential life lost, which emphasizes early deaths. These rates help policymakers assess population health and target interventions. Risk assessment and risk perception. Public health officials regularly perform risk assessments estimating how likely an event is to happen and how harmful it might be. But how people perceive risk doesn't always match expert analysis. Example: experts rank motor vehicles and smoking as high risk, but the public ranks nuclear power and vaccines much higher, often because they're unfamiliar, involuntary, or dreaded. Understanding risk perception helps public health professionals communicate more effectively and anticipate public concern. Another insight: teens often underestimate their own risk. They might know smoking causes cancer, but believe it won't happen to them. That's why education must address psychology, not just statistics. Cost, benefit, and cost effectiveness analysis. When public health policy is debated, cost is always a factor. Cost benefit analysis weighs the financial cost of an intervention against the money saved or lives improved. Cost effectiveness analysis compares different approaches to achieve the same outcome. Vaccinating against measles saves money and lives. In contrast, prescribing expensive cholesterol drugs to healthy young adults may not pass the cost benefit test. These tools help prioritize limited resources in a way that maximizes public good. Conclusion: statistics is the science of uncertainty, but also of informed action. Public health decisions are made in a world of incomplete data and evolving evidence. Statistics help us interpret, compare, and decide. From screening to risk assessment, from cancer clusters to cost effectiveness, public health uses statistics to find clarity in complexity and to guide decisions that protect lives. Call to action. This presentation is based on Chapter 7 of Introduction to Public Health by Mary-Jane Schneider, 5th edition, published by Jones and Bartlett Learning. If this helped clarify how statistics powers public health, share it with others and tell us in the comments: what's one statistical concept you think everyone should understand?